The song of life has a beautiful rhythm. At times we forget the lyrics, but as long as good people surround us and provide the melody, life's music plays on. Welcome, ladies and gentlemen, to Dr. Tapaswini's Corner. That's me, and I work as a head and neck cancer surgeon at the Fortis Hospital, Delhi. Never believe that the lines of your hand predict your future, because people who don't have hands also have a future. So be happy, not because everything is good, but because you can see good in everything. That's the optimism that we see in Miss Davender Madan, a homemaker, a social worker, a model, an actor, and above all, a cancer survivor. Born and brought up in Delhi, married to a naval officer, Ms. Madan has traveled extensively throughout the world. But today, she will share with us her experience and her journey with one of the most dreadful disease, cancer. Welcome, Ms. Davender Madan, to the show, and it's indeed a pleasure and honor to have you here today.
Hi, everyone, and thank you very much, Dr. Tapaswini, for saying such beautiful words about me. I'm really happy to be here.
Now we go back to July 2011. So that was the time when you were diagnosed with non-Hodgkin's lymphoma. That's a cancer which affects the lymph nodes, and you actually palpate lumps in your body. So how did you discover these lumps?
Actually, as every woman does, moisturize the face every day. And I was just doing like that on my throat and felt little bit. And didn't bother much, thinking it's a gland swollen or something like that. And after a few days, I found that it's grown. Then I got worried and talked to my daughter-in-law, and we went to a thyroid doctor.
Okay.
But he said that, no, you go for a further investigation. And that's how I came to know that there's something there.
Right. So it was actually by accident that you felt that there was something abnormal. So which, in other words, we can't really make out as to how long it had been there.
It was not painful, so there was no reason for me to get to know about it.
But did you ever expect that a painless lump in the neck detected accidentally could have been a cancer?
Not at all, because a month before, I had got my annual, checkup, and everything was fine.
Yeah, so in fact, most of the lumps, which we have of the cancer are generally painless. So quite often our patients keep telling us that it doesn't cause me any problem, so this possibly is not cancer. But that's how it tricks us. And they are painless to begin with, but then they become painful when they become very advanced. So life throws a lot of surprises, and often we get what we don't want. Who wants cancer?
Yes.
But then it comes as a surprise, right? So you underwent a lot of detailed workup. There must have been a lot of investigations that you must have undergone.
Actually, when I came to know about it, that it's a possibility of NHL, next day I was going on a holiday. So I went.
So when you went out with your friends on a little vacation, did this not bother you that this disease could have been something? You never had an inkling that you were harboring a cancer?
Actually, I did read a little bit, but still, I said nothing doing. I must enjoy my holiday and worry about it later and then go. That's
what
true.
was the stage of the disease? Did they tell you?
It was just beginning of second stage. It was just the beginning. That's what I was told after the ultrasound biopsy. It was decided.
So what factors makes you decide that who should be your treating physician, or what did you see in your physicians and the hospital before you decided your treating place?
Frankly speaking, never knew anyone or about it, cancer, how to go about it and where to go. Though later on, in my family, my daughter, they checked. about the hospital and the doctors, and they were very happy. So didn't have much problem about that. Straight away went to Dr. Purani and Rajiv Gandhi Hospital.
Okay. So what sort of a treatment did they propose for you?
Of course, the blood tests were there. Then the bone marrow test was done to see whether it's there or not. And then ultrasound biopsy was there. So all those factors together, they decided on the treatment and found that it's an early stage. So not much to worry about. I mean, they're very sweet in telling you and giving you hope that everything is going to be fine. Don't worry.
Great. And lovely. So did they decide that, yes, you only need chemotherapy, or you would require some other treatment procedures like surgery or radiation? What was explained to you?
There was, after two, I think, or three chemotherapies, I was told by another doctor that from the group that I might be needing radiation, 10 or 15, or then I came to know maybe 20. So I said, why should I need this lump has already gone. I don't need radiotherapy. And after another 4 chemotherapies, he told me, he says, you don't need anything else. And everything is going to be fine and not to worry.
So how long was the entire duration of the treatment?
I think started in August and finished October end, because 21 days circle was there. And first time I had to stay 2 nights. Otherwise, 1 night stay was there always. And I think 4 chemo was finished around that time. I think end of October was my last chemotherapy.
So what sort of side effects did you have? Did it ever bother you at all?
Yes, first chemo, because in my mind I had that it's going to be vomiting and I don't know how many side effects. But I had decided not to bother when I'm going through chemotherapy. They give you such big tablets, to avoid the vomiting and everything. And I didn't have any vomiting, though after the chemo, I had constipation. And after 2 days, so much of body ache that I didn't want to get up from the bed, It was very painful, body aches, and took 2 days or 3 days to get it better. And then once I had painless boils in my mouth. But after the first chemotherapy, I was better equipped to face the next one, because I took medication beforehand, before going for my stomach, so that I don't have constipation and backache, so I couldn't avoid. But there weren't many next time, because maybe my body started accepting the chemotherapy, by that time. So it became better every time. So by the 4th chemotherapy, I didn't feel much. And I was actually, during chemotherapy, I was not bothering that I'm going through some procedure or something. I had novel with me in my every time I went to the hospital, I had some books to read with me.
Great.
My daughter, my son used to be there. So I used to play cards with them to avoid thinking about the chemotherapy being given, so that it won't affect me, I mean, I won't vomit or it won't affect me. The more I think about it, the more I will be distressed. So I avoided thinking about it by distracting my mind and talking and playing cards. That's how I went through it.
That's lovely to hear, being positive even during the trying times. And especially that smile of yours, I'm sure you must have smiled it all the way through.
When I first came to know, it was a shock, because, yes, it was, because I never knew anyone with cancer, in my family, around my friends or anything. And then I went to the puja room. We have a puja room at home, and I believe in God. And I went there, cried a little bit, thinking, why should I get it? Because my tests were fine 1 month before. And sat there for some time, decided. Then I mean, it gave me strength after that. And I said, nothing doing. I have to fight it. I have to live for myself and my family. And whatever happens, I'll see. So I have to go through it. Otherwise, my family will be distressed, if I am serious and scared. And after that, I think God gave me strength, and I never was scared about that, anything after that. All through all the 4 chemotherapies, I was perfectly okay and laughing and smiling and enjoying my stay, I should say, at the hospital.
So what precautions were you asked to take during the treatment? Was there a big list that you were detailed on, that you should not take this, that you can take that? What were the various precautions?
First, we were told not to eat anything raw, no spices, always wear a mask, not let anyone come with the cough or anything near you. I should always wear mask so that if somebody has some problem, I should not be affected because the immunity is down at that time, and not to go out too much in public or anything, and take care of myself, little, not exactly isolation, but avoid meeting people,
Correct. But it's very interesting to hear that your last cycle of chemotherapy that you underwent, and that coincided with your 40th anniversary, your marriage anniversary. So how was that feeling? Feeling that you've finished with your chemotherapy, you're rejoicing because that's your 40th anniversary. How did you take those moments? How did you enjoy those moments?
October end was my last chemotherapy, and November middle is my wedding anniversary. So though it was very few days, just about 15, 20 days, but I still thought that why not? It's my 40th and it's not going to come again. It's going to be more and more, and I should though I was careful. And it was a relief, that I don't have to go to the hospital again now, 5th time or 6th time, and I'm free of that. But I was told to take precautions and be careful, and I did try to abide by the rules. Though I went out, but with the mask, and tried to eat the cooked food. And I love eating continental, but I have to be careful in that, because not all is cooked. So you do have raw salads and everything. So I had to avoid that. But I enjoyed I went with my family. That was a big boon, big bonus, I should say, so that all of us could go together and enjoy and be free of that tension which my family was going through more than me.
Yeah, understood. Yeah, we can very well feel it, and we can understand what it happened, what the entire family goes through. Just because with one cancer patient, the entire family goes into a topsy-turvy. What do you think was your source of strength during the entire treatment?
First of all, I have faith in God. As I told you, I went to the room and sat there, meditated for some time, and that gave me strength. First strength was that. Then I knew that I have to get well, no matter what. I have to get well for myself first, and then my family, which is suffering. They weren't showing, but obviously they had. They were troubled, but they were very supportive, never letting me know that they are serious or anything, or they are troubled or anything. They were very big support. And then I had faith in my doctor. I said, he's going to treat me, and he's not going to do anything wrong. He's there to treat me and get me well soon. And that also was a big help in that. And of course, my family was there. And I had belief in myself that I will get well. I will not let it go, and I will fight, to get well.
That's wonderful. So, one of the timeless secrets of a long, happy life is to love work. And we see that a lot in you. You've been in the ad world, you've been in the art world, you've been doing a lot of ads like the Red Label, Amway, Okaya, the Parsavnath. the signatures ad of the Fortis Hospital, a big corporate, and you've done a couple of movies. So, do you think these are blessings which you got post cancer, or uh how do we take
Thank
this?
you for going through my channel and finding so many ads. But
Lovely.
this, I got into it by chance at the age of about 50 and was
Uh-huh.
doing when I got this problem.
Right.
And used to get calls, about auditions. We have to give audition first, and then if selected,
Mm-hmm.
there's always a big if. So I had to refuse. Sorry, there was on my last chemo, one person said, "No, I'll come to the hospital and get your audition." I said, "Nothing doing. I'm coming home today only." And they came that night. Though I couldn't do it because of the PICC line bandage and my wig, I had to wear a wig for that audition. Though I wasn't wearing it regularly. But I did one movie also during my treatment
Uh-huh.
with the wiki donor, though they cut the dialogues, but still I did, because I thought I'm not going to sit home and be in depression that how I'm going to do, what am I going to do. Take precautions and go about a normal life. That was my motto. And I did movie. I did gave auditions also.
So it's also
Uh,
said that the golden thread through the lives of history's most satisfied people is that they all loved what they did for a living. And that's because they all had immense passion in their work.
I live near the university, and I was
Okay.
already doing social service in the Delhi Women's Association,
Right.
and that was also satisfying. And then doing counseling in the hospital, all those things have helped me in my life, and growing.
Good. That's really nice to hear. But then in the day-to-day mundane activities, and there's so much of work. You've been a mother, you've been a wife, you've been a patient. There's so much to do. How do you take refuge from all this demanding life? There's a demand on your time, your energy, your attention. So, what do you do to keep yourself happy and peaceful?
First of all, in the morning, I have me time with a cup of tea and paper when everyone is sleeping. And
Okay.
my puja room, I go there, sit there, and give my mind, a peace, that thinking that what I have to do. And work is good. I mean, acting and it's once in a while, but I enjoy meeting people, so it's not tiring for me. I love to travel. That's
Mm-hmm.
good in that. And my children are married now. When I got this also, they were already married. So my husband and myself, two of us. And I'll sometimes watch TV. I love reading. That's my good relaxation time.
Mm-hmm.
I can read comics, I can read books, anything. So, and meet friends.
Right.
That's how I pass my time besides the work I get to do.
Okay. So, how do you weigh your life before and after cancer?
Before, it was my routine, because I didn't know anything about cancer or going for counseling to people. Only the university, I told you, I did reading and making tapes for visually handicapped.
Mm-hmm.
That gave me big satisfaction that I am giving back something to society from which I have taken so much.
Wonderful.
And after that, encouraged by Dr. Burani, started the counseling, going to the hospital once or twice a week as needed, and
Mm-hmm.
then started the group.
Mm-hmm.
So life has changed
For the better?
completely. Yes, for the better. I am a better person. I have more patience. I can
Oh,
relate to the others' problems now and
mm-hmm.
see through their eyes, how they are suffering, and try to be helpful. So I think maybe this cancer or lymphoma was a blessing in disguise or whatever it is. But it did change me for the better. I must say that.
Right.
It did help me.
There's an ancient Eastern thinking, and it says to live a fulfilling life, you must do three things. One, it says, have a son, write a book, and plant a tree. By doing so, you have three legacies that will live on long after you die. So, what in your thoughts are three things which you think will bring fulfillment to your life?
Three things. Well, I think I feel that if you are somebody will remember me is because of my nature, because I try to be a good human being and good to myself and good to others, you know.
Mm-hmm.
And I don't believe that if I have a son may not turn out to be that well, or plant a tree is good. I love trees. I have lots of plants, but they are not going to live long. Only what you have done and help others, or how a person you were is going to be remembered. So
Correct.
that's what I try, and I taught my children also to be good human beings, and first and foremost, then other things.
Right.
So I think that's how they're going to remember. Be beautiful inside, you will be beautiful outside.
Absolutely, absolutely. So you've been involved with this lymphoma support group. Uh, so what all are the activities that the group does, and how does it help the other patients?
Actually, it's an independent group, lymphoma support, but we are supported by our doctors team, lymphoma group team. They are very helpful to us, guiding us, and we do camps. There, the doctors go with us to help people, and we try and get financial help also from others. And at the hospital, people from villages are coming, selling their homes. We initial and financial help we try and give them for 1 or 2 doses, so that they are motivated, and guide them how to go about getting more financial aid. We hold camps for that reason, to give them awareness, because cancer, as yet, even in educated people, is a taboo word.
Right.
They don't want to tell people that somebody in the family has cancer. So that's what we have to remove. We try and give awareness for that, that it's nothing to be scared of. Now it's advanced times, and a lot of technology is there, a lot of treatment is there. One should go and get the person treated.
There's no higher religion than service to humankind. So you've been doing a
Yeah.
lot after you've gone through, after you've perceived your own journey. It's lovely to hear that you've been involved with so many social activities.
I'm grateful for that, because when I see the patient next time after counseling the first time, and they're in a happier mood,
Right.
it gives immense satisfaction that I've given something little bit back to the society and person.
You are now 70, still that same Miss Beautiful Davender
Oh,
Madan. Now, if you
thank
had
you.
to re-script your life, how would you like to do it?
Uh, I won't change the counseling and going to the Women's Association helping visually handicapped, but maybe if I had to start again, I would love to travel doing tourism journalism, tourist journalism, so that I see the culture. I would love to speak different languages, though I'm not very good at it. I learned French, but I've forgotten most of it. And I mean, most of it is the same, except for my travel. And my family is good. I don't want to change that. But this helping others, maybe in better way. If I had earned more money, I was earning in a better position, maybe I will start something for girl child, because when you see girls outside begging, it hurts. It pinches very much. You feel that you should collect all of them and keep them at a safe place and help them, That's how I feel. I wish I could do. I'm not a very motivating person. I'm not I'm a lazy person actually. I wish I could have done more, for the society. I really wish.
But you're doing such tremendous work. You're doing such good work through so many platforms. But your heart still wants to keep doing a lot more. That's what I see from your
Yes,
expressions.
I wish.
But does this disease sometimes rob you of your peace of mind, your emotional well being? Does it ever come to you again and again? Can I relapse? Can this disease come back? Does this happen to you?
Yes, it did, because, anything different in the body, maybe even a little pain here or there, you're scared. Not touch wood at the moment, I'm not that much scared, because it's almost, I have completed 9 years now. But earlier, I mean, something abnormal, not exactly abnormal, but different, the pain or anything used to feel maybe it's coming up again. Till the time I went to the doctor with the test, the routine test, and they were fine. And the doctor was saying, no, nothing to worry. So it was a relief. Otherwise, for quite a few years, every time you had something, I mean, the pain or whatever it is, you used to feel scared. I used to feel scared a little bit. But maybe then I used to tell myself, no, I don't have to think like that. I don't have to be negative. I have to be positive. I have been positive. So why should I think on the wrong side, that maybe I'm getting it again? No, I'm not getting it again. I will not get it again. Like that, I used to give pep talk to myself.
But you still go for your routine surveillance, routine checkups to the hospital?
So now I don't think it's needed, though I love to go, because I want to go actually once a year for the checkup. Otherwise, hospital, I'm meeting the doctors every week or so. But earlier it was 2 months, then 3 months, then 6 months. And then it was a relief when they said after 5 years, no, now 1 year, after every 1 year you get the test. So because of lockdown, I haven't gone last year. So maybe next year I'll go with the test and see. And I'm sure everything will be fine.
Now that it's more
Definitely.
than 10 years, I'm sure, God willing, nothing should happen again.
Yes, I'm sure.
Well, we are coming to the end of this show. Davenderji, what message would you like to give to all the cancer patients and the masses at large?
So many people are getting cancer these days. It's still a taboo word and a scary disease, actually, still. But you have to be positive to yourself. I mean, you have to believe in yourself.
Absolutely.
And because our body has the strength to fight the disease, any disease. So if we don't believe in ourselves, we will not get better, even if you get given the best medicine, best treatment. And believe in the doctor you are being treated by. Because if you don't believe in the doctor, how will you accept the medicine given by him and the treatment given by him? And the main strength is from your inside. Believe in God if you are God fearing, and be prepared, because death is written by God. You never know when somebody is going to die. It can be normal hit on the street or anything. So don't be scared of dying because of cancer.
Agree.
That is not written by us or doctors.
Absolutely.
So if it has to happen, it has to happen. You may be sitting at home or you may be in the hospital, but you have to be positive to yourself, your insight, that no, I have to fight it. So that gives you the strength to fight the disease better. I think people have come out of such bad situations because of their will to live and will to fight.
Really agree with you. What a lovely message, and the positivity that you exude is enormous. And you are a great source of inspiration and a great motivator. Thank you so much, and thanks a lot for being with us today, Davenderji. It reminds me of a small poem that we used to recite as a child, and it said, "Row, row, row your boat gently down the stream. Merrily, 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 life is but a dream. So, despite all odds, count on your blessings. When we analyze and we measure them, we realize that our blessings outnumber our problems. So, keep the faith and keep going. Thank you so much. Thank you so much, Davinderji. And thank you to all the listeners. See you next week with another episode. Till then, goodbye.